It is my pleasure to welcome you all to this very important side event, the African Development Bank event. And health is very, very crucial. Health is one of the major products that is yet to be fully explored in the whole of West Africa and the whole of Africa generally. When we look at the kind of adoption rates for other services, such as payments, savings, and all other products, you will see that gap and a window of opportunities in health insurance uptake within the African continent. For example, in Nigeria, as at 2023, payment uptake is around 52%. Savings is around 38%. Unfortunately, health stood at 3%. So, and I think that's the same dynamics that we have across Africa. So, and we are good to have this coming to the front burner. And we have a great expert in the house to help us have conversation around it. We need to be able to understand why has Africa not been able to really fully tap the opportunity in the health sector. Is it about policy? Is it about financing? For the fact that we are aware that most of the financing are public-driven across Africa. So are we going to explore other strategies to scale? Because it's only a well and healthy human resources that can actually turn around capital in Africa. So this is very important, and we have to key into it. So today, we are looking at strengthening Africa's capital for development. That is the major theme for this AFDB event. And we are looking at the role of robust health financing systems towards the advancement of Africa human capital for social and economic growth. That is exactly what we are trying to note. And we have been able to put together the best experts in the whole of the continent to come and have these conversations. And it's my pleasure to once again introduce our panelists to the stage to really come and really help us to explore this understanding. So permit me to introduce our panelists. I will be introducing Dr. Jeff Inamani Dorothy from Nigeria, MD CEO, Novo Africa International. Please step forward, madam. So I'll go to the next, Dr. Issa Faye. Please help me welcome Dr. Issa Faye to the podium. The next on my list is Mr. Taye Emogba, the divisional head of Manufacturing Industries, Large Enterprise Directorate, Bank of Industry. You're welcome, sir. Please help me appreciate him. And I have here Dr. Hope Iweju, the Chief Engagement Officer, African Economic Forum. Please help me appreciate Doctor. So I also have one of the powerful fintech enabling resource person in the house, in person of Mr. Cedric Ngede, is the Executive Director at Tenor Technologies. You're welcome. And I will permit me to also welcome Dr. Issa Faye. I have him on the board already. Thank you. So, so we will quickly move to our question and answer segment. Okay. So, thank you so much. We will be looking at generally the pillars, the four pillars in the health conversation. We're looking at the economics of health. We'll look at innovative financing models. We'll look at the resilient health systems. We'll also look at the policy regulatory framework. Those are the very critical four pillars that our conversations we structure around. And I am sure that at the end of this conversation, we will have something to really take further and implement to advance and deepen health insurance uptake across Africa. Thank you once again. I will be going to my first question. Mr. Tayo of the Bank of Industry, we are glad to have you here. Yeah. So there is this very major concern about how can the financial sector reposition healthcare from a public expense to GDP-linked investment class. I will repeat it. I will repeat my question briefly. How can financial sector reposition healthcare from public expense to a GDP-linked investment class? And a follow-up question will be, what models I really imagine in Nigeria or elsewhere that demonstrate measurable economic returns on healthcare investments? Thank you.
Thank you so much. Good afternoon, ladies and gentlemen. I think the first thing would be for us to look at the benefits rather than as a cost. What's the cash? Health is wealth. So if we look at it from that perspective, we should know that investment in health is not a cost. It's a benefit. Because if you have a healthy population, you have good workforce. It will lead to increase in production. So it's an investment. But what has happened over the years that we've looked at it as the initial cost of investment rather than looking at the long-run benefit from investing in health. So it's going to be a mind shift. We should shift our focus to look at this as investment. That, of course, will help us to move ahead. So in terms of what model we need to put in place, I work with Bank of Industry, our DFI. So I think the DFI should look at how to put long-term funds into health as against the short-term funds that come from commercial banks. So that will be the focus. And I think I would like to start in that perspective. Thanks so much.
Fantastic. Thank you so much, Doctor. I think he's been able to really let us know that financing health requires more than just short term. And we need to be thinking about long-term investment to drive health. So I will want Dr. Hope to make a remark on that question of the models and also the transiting from a public expense kind of model to a GDP-linked investment class. Thank you, sir.
Well, thanks for that question. Actually, if we review the health sector in Africa, you will notice make some very sharp observations. One, there is this belief that healthcare is an expense. I was quite happy that the Bank of Industry says you invest in healthcare to improve economic productivity. But it actually goes beyond that. As a matter of fact, healthcare accounts for up to 17 and at times to 20% of the GDP of major economic powers in the world. If you take the United States, up to 17%. So the healthcare sector is a sector that is actually worth investing on, using any indices of good investment. If you take Nigeria, for example, you have a population of 206 million. If you invest in healthcare, it's a major employer of labor. If you invest in healthcare, the returns are solid. And many technologies that you would derive from investment in healthcare actually will flow to so many other sectors. If you talk in terms of the public spending, it's also not true that the public expenditure on healthcare is what has been driving the system. The out-of-pocket payments in many of the low to medium economic countries, of the countries in Africa, are actually been accounting for about 60 to 70% of expenditure on healthcare. Most of the governments in Africa have been spending far below the Abuja minimum declaration, which is 15% of the budget. The national health account reflects that. So moving forward, the model is this. It is in the interest of African economies to invest in healthcare, first, for economic prosperity, secondly, for all the good factors which my colleague from the Bank of Industry have stated. So I think moving forward, we need to do all those things that will promote investment in healthcare and also reduce the lack of transparency and accountability in terms of public expenditures for health. I want to stop there. I'm sure as we move forward, we'll take more of the issues that arise. Thanks.
Fantastic. Thank you so much, Dr. Hope. I think I will still want Mr. Taye Emagba from Bank of Industry to be able to help us to make a reference if, as of today, there is a particular product for health financing in the Bank of Industry.
Yes, we do. I mean, our role as DFI is to actually support all sectors. So we actually have a desk. The way we are structured in BOI, we have a desk strictly for health, and our responsibility is to lend to the health sector. So if there's anybody in the audience who want any particular borrowing, you can engage us.
Great. Thank you so much, Mr. Tayo. So I will go to the only female on the panel list, and I think she's been doing a great job within the informal health sector in Nigeria. We have met on the field several times, and I can see that she's been doing a great job within the national and sub-national in terms of stepping down the health services. So, Doctor, I will want you to let us really know, how does investing in economics of health directly influence capital development and promote health equity across population? In terms of the economics of health, how does that really influence human, capital development? Thank you.
Thank you, Fasasi. When we talk about investment in economics of health, it's important to understand that the focus is on affordability, access, and equity. And not just in clinical structures and building of hospitals and pharmacies in healthcare. So when you look at the economics of health, you're looking at a system whereby healthcare is made affordable to everyone, and everybody in turn contributes also to the pooling of funds in the health system, which will in turn ensure that we have a very resilient and stable healthcare system, which also transmits that stability into the economy. So, in terms of human capital development, it's a no-brainer. We all know that health is wealth. So by investing in the affordability means that everyone can access healthcare when they need to. It means that by affordability means that people are insulated from health shocks, which normally drives people into poverty. So by this, the human capital resource is influenced in terms of productivity. A healthy population, we know, is a productive population. And that productivity translates to economic growth. It increases the GDP per capita. It ensures that we have people who live longer. And by living longer, people are looking forward to retirement, people are saving, and also there's more investment into the system. So productivity, not only about the individual. From a macroeconomic point of view, there's national wealth. The employment also increased because I think it was Dr. Hope that also mentioned about health being a top employer in the society. In short, it's mentioned that health is regarded as the job motto for the overall economy. So that shows the direct relationship between healthcare and employment. So we need to look at health from its contribution into the society, people being productive, people living their best lives, children are able to go to school, and of course, going to school means that they have more chances to economic success as adults, and so on and so forth. So health should be looked at as an investment because it is the most important investment to ensure that countries grow and the economies are stable. I'm not talking about all the complementary health funding that is being done. A stable, resilient health system ensures sustainable economic growth.
Thank you so much, Doctor. I think we are thrilled with a particular model that I saw you exploring in Nigerian markets because most people that are excluded from health services are more of the informal segment of the population because health is not mandatory for them. For the formal sector, I think it's mandatory. Health is part of the standard procedure once you are employed in a formal sector. But fortunately for us in Africa, we have larger percentage that are in the informal sector, and up to today they don't have health cover. So and I observe that most of these people are accessing credits, they are accessing interventions from governments. And I saw that you are coming up with a kind of a model of combining credit with health services. Can you share that experience with us so that there is no way people will, access all those key and those priorities, and they will not also prioritize health? Thank you.
Okay, thank you. So it's important to know that everybody wants to be healthy. Both people in the informal sector and those in the formal sector, everybody wants to be healthy. And what we have in our health policy, it translates to both sectors. So it is not only for the formal sector, but also it is mandatory for the informal sector. But the issue is in enforcing it, implementing an effective financing system that ensures that the people in the informal sector are also brought into the health pool. And you can understand from where we're coming from, over 70% of Nigerians, and I'm sure that also translates to other African countries, live in poverty. So they do not understand the perspective of having a financial, to be prepared financially for any health eventuality. And this, like I mentioned before, once there's a health shock, they are being thrown more into poverty. So we looked at this. Because they don't have the incentive to make health a priority, how can we not just educate them the importance of health, for them to attach and see that their financial risk, health is just not about going to the hospital when you're sick, but there's also the financial risk of ill health. So Novo Health came up with a product that actually is complementary to you. We put other products into this suite. So there's a suite of products to make it, to incentivize people, to make them change their perspective of health insurance, and also ensure the adaptation and adoption of health insurance. And what we did was to adopt a system whereby there is an opportunity not only for health inclusion, but also for financial inclusion. So this combo actually enables them to look at health differently. So we're saying, look, while you are struggling, because the informal sector is the people who go out every day to fend for their daily bread, right? And they need their health. Their bodies, their health is the only thing that they have to ensure that they make money on a daily basis. But unfortunately, for lack of education or for lack of understanding, they do not know this. And a lot of the micro and small enterprises that is invested in fall under this group. And you find out that when one person is ill, they're not able to continue with their work. And what happens? They go down, they lose their income, and might not even be able to come back up. So this product allows us not only for them to invest in their healthcare, but also invest in themselves and in their businesses. So that was an incentive. And we structured it in a way that it took care of all of the issues that surround health insurance. Like I mentioned, the issue normally of enforcement, implementation. So to ensure that we have a sustainable product, what we did was to make sure that issues such as adverse selection, which always happens in insurance, and sustainability was taken care of. So we partnered with multiple partners, reinsurance companies, local banks, and tech companies to make sure that it's an all-round program. So with this, there's more of acceptability. We started with 2,000 people. Now we have up to 20,000 people. And we still have other people who are in the database that are yet to uptake, but we see that the responses have been very positive. And we have loaded it on a digital platform that allows us to scale it up, to scale it across the continent. This platform enables the program to, we can actually carry it out in different African countries, in different cultural contexts, and also in different regulatory environments. So very flexible architecture. And we have indeed, I feel that we have indeed gotten to the point whereby the whole of informal sector is looking out for this product. Thank you.
Thank you so much, Doctor. That was very, very innovative, and we'll be following the trend and how that is scaling in Nigeria so that we can actually replicate it across the African continent. Thank you so much. I think it's very, very crucial to look at our development bank role. Luckily enough, we have our Director General of the Global Practices and Partnership, GPP Islamic Development Bank, and a leading voice in development financing and gender responsive policy implementation. And I think we have a very great honor to have you. And I think we need to really look at it. What exactly is your suggestion on how a development agency quantify the impact of healthcare on a broader economic resilience? We need to look at that, especially when targeting women, children, and informal sectors. Thank you, sir.
Thank you very much. I would like to thank you for inviting me and thank the African Development Bank for this session. I'm not sure I'm going to tell you really how we're going to measure the impact, because that's a very difficult exercise. It's not very easy to do very often. But I will try to tell you a little bit how I see the economic dimension or the economics aspect of investing in healthcare. Simply, strategic healthcare is not a moral imperative. It's not just about moral, it's about economics. It makes economic sense, because if you look at the numbers, Africa loses up to $2.4 trillion annually in productivity due to health issues. So this is really telling. That number is very salient and saying that there is really an economic opportunity there that we need to pursue. And then we've seen it in our project that are very bankable. Investment in healthcare is bankable, let alone the impact that can has on public health and development and so on. The other reason why it's important to invest in healthcare is linked to what we have experienced over the last 4 or 5 years with the COVID pandemic, and then currently the geopolitical dynamics. This tells us that Africa need to be self-reliant. We need a health sovereignty in our countries if we want to be resilient. So this is really another important factor why investment in healthcare is important as we go forward. And the last point is about the inclusion, and I'm very glad my neighbor here has touched on all good points there. How do we make sure that the healthcare system is robust and inclusive enough to deliver for our people? And then you mentioned informal sector, the women, and so on. And I agree with you. It's about affordability, access, and also making sure that the services are available to all. And then when we look at it at the Islamic Development Bank, investing in healthcare, we look at different verticals. We look at the primary healthcare is one area where we invest. Pharmaceutical manufacturing, because of COVID, we wake up. Actually, it was a wake-up call to know that pharmaceutical is something that we cannot rely on somebody else. If COVID ups and then the logistics chains are disrupted, and then you are done. So we need to make sure that we invest in Africa into that, and we have done it in a couple of countries. Senegal, we have Institut Pasteur now providing COVID vaccine and all that. And we've doing it also in Egypt with Vasquera. So we're investing in that. We're investing in radiology and oncology because the treatment of cancer and all these diseases is not well. And then last but not least, technology. Technology will help us increase outreach, make sure that we deliver for those who are in remote areas, for example. So we are really investing in telehealth and telemedicine. And then we have really interesting program that in Pakistan that was bringing, for example, women doctors, that in the gender part, the inclusivity part. And then in those countries, we because of the social norms, many of the women doctors were not practicing their medicine. So we brought them back and then using telemedicine and telehealth, they were able to now practice. So this is something that we are doing to increase the inclusion and so on. So I think that looking at the availability on different services and not, last but not least, insurance. Medical insurance in Africa in general is not really, it's not part of our culture. And then people are not prepared, and then they're not really going to seek medical insurance. But this is something, and this has to be, I mean, we need to try to provide universal coverage of this medical insurance. And I think that this will help really leave no one behind in terms of the coverage and in terms of inclusion. So I think that these are some of the things that I can touch upon just on this economic dimension of health, and then how we can improve inclusion.
Thank you so much.
Thank you, Doctor. I think it's becoming very interesting that we have the wide knowledge of areas at which the DFIs can actually intervene in supporting health. The most captivating of all to me is actually investing in the technology, and how investing in technology is able to also capture and include the children and women. By the time you invest in technology, definitely some part of the African countries that you cannot reach their women, technology can reach them. Where you cannot reach, you know, the young ones, the children, technology can reach them. I must commend you so much for exposing that to us. Thank you so much, sir. Yeah, so Mr. Tayo Emagba, I also want you to please contribute to this major topic of the role of DFIs and the national development banks, the role they are playing in de-risking health projects and incentivizing private sector participation in health financing. Thank you.
All right. Thank you so much, Mr. Moderator. I think what we're doing at the moment and what I think DFI should continue to do is to continue with the issue of blended financing. Because from the commercial bank perspective, their cost is high, and it's purely they're in business to make profits. But the DFIs can come with lower interest rates, so that it becomes a blended program, which will then reduce the cost for those who want to borrow for the health sector. So that's an area that the DFIs are doing. DFI are also investing in research and development, and that's what my colleague from Islamic Bank spoke about, the issue of research and development. I think that's one thing that is lacking in Africa, to be honest. We don't invest in research, and it's about time that we deliberately, do that. So that's another area that we can improve health. Another area is the area of PPP, public-private partnerships. We need to partner so that we can go far. As they say, if you want to go far, you need to have commitment. So we need to do more of PPP, so that we can bring the expertise from the private sector, the area of the more capital, and on the public sector perspective, so that we can go far. So there has to be deliberate collaboration on the part of everyone to ensure that we can go far. Because right now we need it in Africa. With what is happening in the world right now, we know there's no free money again with the Trump era and all of that. So it's about time that we in Africa deliberately sit down and partnership so that we can make progress. Thank you.
Thank you so much, Doctor. I think that's a very great information for the African governments generally. There is a limit to what public infrastructure can cover in terms of health. We are aware that most of the facilities are overstretched, and also the human capital resources, they are in shortfall across Africa. But if we are able to liberalize the strategy and combine it using the private sector, public partnership, I think we'll be able to scale and to be able to impact. Thank you so much for that. Mr. Cedric, I will really need you to come to the head of this conversation in the area of technology. What are the most promising technology-enabled financing models, such as AI-driven underwriting, health wallets, or blockchain-based claims processing that can really close the affordability and access gap? Thank you.
Thank you, Mr. Moderator. I think the intersection between technology and health financing is really unlocking a lot of pathways to universalities, affordability and transparency in terms of healthcare delivery, from enrollment to underwriting, to service deliveries, to claims management. Every segment of the insurance value chain can be enhanced through digital innovation. For example, AI-driven underwriting can actually reduce the cost and the complexity of risk assessments. Your traditional models are relatively expensive. They're dependent on clinical records or invasive diagnostics, whereas using AI-driven models, we able to, one, focus on demographic data, which are very key in terms of understanding the element of risk in terms of a particular population, as well as behavior data. And these tools allow to rapidly assess, one, risk, price premiums a little bit fairly in terms of a micro health product, but also, while pricing it fairly, it allows us to kind of tailor products that are, user-friendly, but also are based on the risk profile of the segment in which we're trying to look after. So it obviously thereafter increases the uptake of various policies. Other innovations in the sector includes health wallets, right? So health wallets coupled with aspects around mobile money. It looks and seeks to democratize access to healthcare. It allows policyholders to do three things. One, the ability to save through these wallets. Two, the ability to borrow through this wallet. And the third aspect, to receive subsidies in terms of health financing, right? So that it allows them to participate in traditional health insurance that normally would not be accessible to them. The secondly, it allows different blended financing model that my esteemed colleagues talked about to be superimposed into these wallets. And the third aspect, we're Africans, where we rely on a lot of support from families across the continent and globally in the diaspora. It allows those fundings that come in for healthcare to be one placed into various wallets. There's accountability in terms of what it is used for. There's obviously record keeping in terms of the different payments and the flows, and it's tracking all of these components. And the next technology that enables a lot of this is blockchain. Blockchain enhances transparency once again. It allows the ability to audit the different trails in terms of these wallets, in terms of these micro insurance products. It supports enrollment of policies through smart contracting that allows the speed of not only from an AI perspective, the underwriting piece, but also the onboarding of policy members without all these hassles of large paperwork that some of these segments don't have an understanding of. Whereas the small contracts are written in such a format, one, that is understood. Secondly, that it can easily be navigated. My esteemed moderator talked about the advent of payment system, the adoption of payment systems. smart contract allows and further perpetuates the adoption of payments into the insurance sector. So these technologies are really supporting the nexus between affordability and the much needed health financing in terms of, once again, allowing and increasing the adoption of micro health products, different types of blended, financing products, supported by technologies that looked at, different credit algorithms that once again profile affordability, not just from a financial perspective, from a non-financial, looks at demographic data, environmental data. It looks at how do you aggregate different co-ops and groupings of individuals to be able to become the guarantors of the different lending groups or user groups that once again allows the de-risking of financial products into that demographics, and once again increasing the adoption of these blended and innovative health insurance
Fantastic,
products.
fantastic. Thank you so much, Mr. Cedric. Because of our online audience, this is very key, and they have been waiting for this information. So, and I want Mr. Tayo from the Bank of Industry from the regulatory standpoint, what changes could actually unlock more capital inflows into the health sector, especially our numerous startups, community clinics, and local manufacturers?
Thank you. I think the first thing would be to simplify the registration processes. There are a lot of bottlenecks. So, I'm not suggesting that they shouldn't be thorough, but the suggestion is that the process should be clear. The bottlenecks should be removed. It's important so that people can understand exactly what the requirements are, and that policies should be consistent. So that's one issue that we need to deal with. Again, collaboration. We can't overemphasize that. There's need to collaborate. For the communities, of course, we should build more hospitals. There's no doubt about it. We should make health accessible to the poor and everyone. So it's about the processes should be clear. Of course, provide incentives also. It could be tax break, it could be anything, but you need to provide incentive for manufacturers. Most equipment that we have in Africa, we actually import them. So if there's a way we can also have some duty waivers and all of that to encourage, medical practitioners to come into the practice. That will go a long way to help the system.
Thank you so much, Mr. Tayo. That actually struck me because, especially on the area of processes. In the last 8 months, we have been trying to onboard BDSPs to scale some of the Bank of Industry products. I know there are a lot of funding available, but the processes are so cumbersome. And for example, when you are talking about how do you finance a startup, so the major question will be, how do you score somebody without an history? That's a startup. A startup has no history, transactional history, and most of the processes and criteria, they are generic. What you have for startup is what you have for our existing businesses. So in the health space, I think those processes are very, we need to be able to simplify it and to be able to categorize and reprofile for us to scale. So thank you so much for touching that, sir. Yes, sir. So I will quickly move to Dr. Dorothy. Dr. Dorothy, how can insurers better integrate with healthcare providers to ensure timely payments, reduce fraud, and drive efficiency in the service delivery? I know that you have a lot of experience trying to integrate the National Health Insurance Scheme, HMOs, and even the informal space. So with all these experiences, can you please let us have your input on that?
Okay, thank you, moderator. For a peaceful coexistence between insurers and the healthcare providers, I think the spotlight should be on financial healthiness of the health ecosystem and also operational efficiency. So it's important for us to rethink that relationship and move away from the transactional relationship between them at the moment to a more collaborative approach, which Tai also mentioned will also help the industry. So also that gets me to talking about what Tai mentioned. He talked about them building hospitals, but the issue has always been, whether you're building more hospitals, how do we get the patient traffic into those hospitals? And that's why I'm so interested in health insurance, because without the patient traffic, the hospitals will continue to suffer. And they're very, very low cost systems that can be applied to ensure that we bring this patient traffic, and then both the insurers and the providers are happy for it. And then the providers can then focus into providing quality healthcare services and a more person-centered healthcare. And then with that patient inflow, a big patient traffic will ensure that insurers also pay the provider on time. It also ensure that we apply things like pre-claims financing, invoice discounting, and the providers will then also have enough capital. So that will help them to optimize their balance sheet, and when they do that, maybe banks like yours will use the money in different places, and then the health system needs to be on autopilot. And it is this free increased flow in patient traffic. So maybe we should start thinking of focusing more of getting everybody into this system. So the pool. So people are driving and they're responsible, for their own health. With that saying, the insurers play that part of being the catalyst. Their role is quite pivotal in health insurance, and provider cost effectiveness and also performance. Also, the collaboration will also lead to interoperability. We'll talk about that now. A lot of data is flowing, but when people are not hiding, behind their data or limit fraud, because they know that there is enough in the pool to go around. Because it's this, if I see a patient today, I don't know if I'm going to see another one, that leads to so many of the sharp practices. So with a bigger pool means that there's bigger monetary value in the system, and also more patient-centeredness. The quality of care is better, and we also have better outcomes. Thank you.
Thank you, Doctor, for that expository feedbacks and response to that question, because most of our audience, especially the online audience, they are much more interested in that aspect of our conversation. So to all my panelists, I want us to have a kind of if we are to take, what single investment or policy intervention would you prioritize to make healthcare a true engine of African development? Let me start from Dr. Issa.
Thank you, Mr. Moderator. I think you need a combination of kind of actions, not only one single action. I think it all starts also about leadership. I I think that you need political will and clear leadership to push on the national strategies to make sure that healthcare system is really a priority. In many of our countries, the problem is that we don't consider healthcare, education, those basic as priority. You go to the Minister of Finance is deciding on budget, and they're not looking at that. So we need to have the push and the political will to make sure this is part and parcel of the key priority areas. And the African Development Bank, Islamic Development Bank are trying to help in that. We are working with WHO and the African Union to try to really push healthcare as part of the key priorities. I think that's one. The second is that once you have that in the strategy and then clear in the policies, you need to have the money. You need to have concessional funding, and this is where the blended finance will come, and this is where DFIs or MDBs like us, we can come in. Wow. We can come in because we can have some grant funding that will help the risk to make sure that we invest in technology, in ARD, and so on. So combining the grant financing with our ordinary capital will help really build a robust healthcare system, because you need long-term money as well. Because you need it's infrastructure, there is the software and the hardware. And then for the hardware, you will need the long-term funding and all these things. And my colleague talked about the PPPs. But there is one dimension of PPP that you didn't touch upon, which is very, very important, which is the advisory part. It's not only to bring the public and private partnership, but also trying to raise capacity in the healthcare system. Make you the upskilling of the healthcare professionals. And this is also where some private equity funding would be important, because you need some hand-holding into changing the whole sector. And this is really, really important to have. And last but not least is to work using country platform. As MDBs, we need country platform. We need regional platform that could bring together the different verticals that I was talking about. The primary healthcare, the vaccine production, the oncology, the radiology, all this need to come through a platform. And that's where you can maximize and then help the trafficking of patients. Not going into different areas, but having everything in the same kind of area or localization. And then digital, yes, digital is the future. And I think that the only thing that I see which can be a downside in data and digital and AI and all this is we need to make sure that there is data protection. We protect the information. Information protection is really going to be one key thing to regulate and make sure that this works for our people. Thank you.
Thank you. Dr. Hope? Yeah, Dr. Hope. What's that single intervention or policy that will you recommend, please? Thank you.
Yes, I think for me, the treating healthcare as a major investment and then align forces. Today we're looking at how Novo Health Africa, for example, is taking the responsibility of trying to drive this process. The question we should be asking ourselves is, why don't development institutions fund this type of process? Why must they wait until when the results have been overwhelming before they invest? We need to begin to take a more collaborative approach. And I believe the more we do that, the more the healthcare will be able to deliver on its mandate. Thanks.
Thank you so much. So can we have your contribution, Mr. Yeah.
Oh, okay, thank you, Mr. Badruta. For me, I think the single thing I would recommend is primary health care, to be honest. We need to do more of that. Starting from the community level, we need to train our healthcare workers. We are losing the few nurses we have and doctors, we are losing them to the West on a daily basis. We need to look at the issue of remuneration to the health workers. That's the basic reason why they all, in Nigeria, we call it the Jagba syndrome. So we need to do more of that. We also need to build infrastructures. There's infrastructure debt in Africa, and we need to do that. If a doctor wants to set up a hospital, You have to do the road yourself. You need to do water yourself. So the responsibility is overwhelming. So the government need to deliberately invest in infrastructure, and I think that will go a long way to help the health sector in Africa. Thank you.
Thank you so much. Yeah, Cedric, what digital or technological intervention or recommendation will you give? Thank you.
Thank you very much, Chair. I think what's really critical from a technology standpoint is really policies that drive not only digitization, but the emergence of the data era, and how do governments have the right kind of data policies that drive transformation, with a focus on how do we focus in terms of this journey on the people. How do we put people in the forefront of data strategies? In other words, how do we train our people to understand that one set of data has a critical impact in service delivery across their health systems? How do we make sure that we develop data strategies from a policy standpoint? And most importantly, how does that align to the infrastructure from a technology that is required in order to support aspects around interoperability in terms of data across different healthcare systems and different practices, aspects around, telemedicine, aspects around policies around diagnostics as a service, and. I think there's a lot of aspects that technology can support in terms of a resilient healthcare system, and I think the policies around that stems from the fact that we need to move away from digitization and get into data transformation.
Thank you. That is a major point. We really need to move as quick as we can to digital transformation. Yeah, please, our audience, physical audience and online audience, do we have any questions for our panelists? Any question? Please step forward. Yeah, please step forward.
Good evening. I would say this is quite enlightening. Learned a lot since I came in. But my question is, would you have something like a communique that can further disseminate the things you have discussed and the conclusions you have reached, so that it can reach those who will make the necessary interventions? That's my question. Thank you.
Thank you so much. I think I want Dr. Dorothy to respond to that.
If I understand the question, how are we going to take this further? Yes, there will be a communique for this, and we will keep having this type of engagements. After this, we will also be writing to the AFDB and probably to Islamic Development Bank. Currently, we're already partnering with the Bank of Industry. And I'd like to say that one thing I would like to push for and encourage people is for us to have a development bank for health. I think it's about time. We have Bank of Agriculture. We have Bank of, industry, Bank of Energy. I think it's time for us to have a development bank for health that understands the pain points of the health system. And so that also some of this health funds that are coming in, can be strategically pulled into one pot and then disseminated, because we have parallel programs on health. And when you hear about the monies that have been spent on these programs, you're wondering how come we haven't even had, the type of impacts that we desire. And there are very low-cost programs that can lead to very large outcomes, yes. So that's something that I think I will push for. And also being in this forum, in 2016, I was in Zambia for this, where I spoke for the same annual meeting. And I will tell you the truth, the thinking in health has not changed. You find out that I was discussing with Dr. Issa before we started. I said, this is what happens And when can we start understanding that investment in health, for trumps everything, in my opinion, because without healthcare, there's just no other thing happening, So these are the things that we continue pushing, and we hope that sometime the government, the development, that will understand that they really need to do something about seeing healthcare as an investment, to encourage the health departments and finance departments to have a handshake, because some of the problem is that the progress that we make on health is not being translated, in monetary values. So says, okay, we reduce the burden of malaria. What is the monetary value there? Once we can have the numbers, the same numbers don't lie. Once we can have these numbers, it will be more, I think there'll be more commitments and more collaboration, not only in the public sectors, multi-sectoral partnership, but also public-private partnership. I hope I've answered your question. I believe we have rapporteurs for this session.
Yes, I think so, yeah.
Mentioned about a development bank for health needs to be documented.
Yeah.
It needs, otherwise it just flies with the wind. Or if it's documented, it can be taken forward. Thank you.
Thank you so much, our wonderful Mr. Femi Adesina, the former spokesperson for the former President Buhari of Nigeria. We appreciate you speaking from experience. So I think it's very, very important if that is going to be the takeaway of Bank for Health, I think it's something we need to work towards. It will help all of us. So thank you so much. Any other question from the audience before we proceed? If you have, please step forward. Any question for our panelists? Okay, in the absence of none, can I have parting shots? Okay, please come. Female inclusion, please step forward. Thank you.
Bonjour, chers panélistes. Je parle français. Je me nomme Zézéza. Je suis une récente diplômée en administration du développement économique. Par rapport à la contribution de la santé, pour le développement, je pense qu'on oublie une limite, l'orientation de nos politiques de santé. Ici étaient partagées plusieurs initiatives pour améliorer nos politiques de santé. Mais je pense que ce qu'on oublie, c'est la direction de nos politiques de santé. En Afrique en général, nos politiques de santé sont orientées vers la guérison de la maladie au lieu de la prévention de la maladie. On parle seulement de santé, pourtant il y a aussi le bien-être. J'ai entendu dire que la population ne part pas fréquemment dans les hôpitaux. Mais une population qui pense qu'on part à l'hôpital pour guérir la maladie au lieu de la prévenir n'ira pas de façon récurrente à l'hôpital. On dit aussi que les agents de santé désertent les hôpitaux, mais ils ont raison parce que peut-être quelque part ils n'ont plus de challenge, ils sont toujours face aux mêmes habitudes, aux mêmes comportements, aux mêmes exercices, je veux dire. Alors, ce que je dis, c'est que nos politiques de santé doivent être réorientées. C'est-à-dire, au lieu de vouloir guérir la maladie, par exemple, on dit couverture maladie universelle. Au lieu de vouloir guérir seulement la maladie, il faut aussi que nos politiques de santé s'orientent aussi vers la prévention de la maladie. Parce que le bien-être, c'est un ensemble d'aspects, c'est-à-dire le bien-être physique, mental et social. Si nos politiques pouvaient sensibiliser aussi sur ces différents points. Merci.
Yeah, Dr. Cedric.
Thank you very much for that question. I think I'll allow our medical doctors to be able to weigh in on it a little bit more effectively. But I think the question and the comment from the audience was really around how do we focus on policies around prevention as opposed to just purely treatment? And I think there's a bias, as the audience member mentioned, towards ensuring that folks have access to health care as opposed to education around preventative health care. And maybe Dr. Dorothy could weigh in on the preventative health care component and not just policies around access and treatment as an outcome.
Let me just make a comment before Dorothy. If health is viewed as an expenditure, why would you want to spend so much money from a long-term perspective? I think, looking back, that it is more cost-effective for we to see health as a continuity. I agree totally. For example, I don't want to go to an hospital and I'm being told, oh, we are thinking of diagnosis A, B, C, D, E, F, G, H. I'm not being told what I have done that had made me look so good. I'm being told, you have to come and do this test because we want to rule out prostate cancer. It is fearful. In fact, as a kid, anytime my daddy then say we should go to the hospital, I start crying. Yeah, but I also remember that even as a kid, I had a white doctor. Each time I visit him, he gives me a cake. Gives me cake and invites me to take some soft drinks. And because of that alone, at times I just want to go to the hospital. Yeah. Yeah, as funny as it may seem, most people view going to the hospital from the diagnosis of punishment. We can change that. Health centers should not be seen purely from the diagnosis and the injections and the pains that go through it. We need to begin to see health centers as life centers. Centers that are not just concerned with health, but also concerned with building sustainability and income. Why can't a health center be a place where women are also trained, not just to take care of their babies, but also made to know that they can also profit from some of those things? But of course, I've left medical practice quite a long time, so I want to defer to Dr. Dorothy, who is still very much in it.
Thank you, Dr. Hope.
Thank you for that question, and you're indeed right. It's cheaper for us to deal with these issues from a preventive point of view instead of treating in the hospital. If you look at it, malaria alone costs the whole of Africa over $12 billion. Imagine if we use this $12 billion to initiate programs on preventive health. Imagine the accumulation. That's the number of years of healthy lives of, in the population. So, and then putting a number to that, that will tell you how much, we are not only saving, but also making. So prevention is important. And this is also why when Novo Health launched Jolly Health, which is a micro health insurance program, we made sure that we underpinned it in prevention and also the basic diseases. That's the prevalent infectious diseases, because this is also large. These are the things that cost money and then cause issues of complications when not treated. Somebody who has a headache that couldn't go to the hospital, who would have gone, or who would have been told what to do, then doesn't do it, and before you know it, we're talking about issues of cardiac issues or kidney issues, and then that even costs more money. Dr. Faye was talking about oncology and things they're doing in cancer. What causes cancer? Stress is one of those things. So preventive healthcare, if we can finance programs on preventive healthcare for mother and children, talk about nutrition and all of this, it makes sure that we avert future complex issues on health and spend less. So in terms of finance and also healthy population and productivity, which is the theme for today. Investing in preventive health services is more important. And maybe we have to find a way of making it tasty. Like Dr. Hope mentioned, we have to find other incentives because people don't care about their health. With all the education that's been happening and awareness, what I would suggest is that we start putting incentives around it. Maybe bundling healthcare and some other programs that people find important. Maybe programs in finance, program in agric. Like right now, Novo Health is speaking with the Ministry of Agric in Nigeria to partner with them on a program that they're about to launch. So it's important that we have that collaborative approach, and then through public-private partnership, put in healthcare. And you can imagine for farmers, there will be a lot of education, awareness. They don't even know how their job relates with their health, knowing that they need their body, they need their physical well-being to be able to go to their farm. So preventive health is very important. I agree with you, and is one of the anchors of our Jolly Health program.
Thank you so much. I think it's been very engaging and very helpful to have this conversation since the last an hour. And I think it's very crucial, and we know it's better now that there is a need to have perfect understanding around the economics of health. From this conversation, we have positioning healthcare as a productive economic investment and its direct impact on workforce productivity, national GDP, and human capital development. I think that point is well noted, and based on one of the case study in Nigeria with the Ministry of Agriculture that Dr. Dorothy mentioned, the government have been pushing out a lot of interventions to various segments of the population. And we just have to call their attention to the fact that you can't be giving out intervention for agric inputs without taking care of the person that we utilize the agric inputs. Over 30 million farmers are going to be supported. So we have to push it to them. As you are pushing cover for agri inputs, you have to also make health very mandatory to be part of that intervention. And we are glad that they are also working along and with us. So that's then we have also had this engaging conversations around innovative financing models. I think our panelists, they have been able to let us realize that exploring blended finance, insurance-led health access solution, AI, fintech tools, and scalable approaches to reduce out-of-pocket healthcare expenditure, very key. But also the resilient health systems. We have agreed that strengthening system capacity to manage shocks, increase equity in service delivery, and industrialize risk pooling and result-based models. I think that's part of the conversation there. Then on the area of policy,